Hi, I am Brittany Weinstock and I am a nurse practitioner in cardiology. I would like to take a moment to discuss with you today about heart disease. Heart disease, also known as cardiovascular disease, is the leading cause of death globally. 1 in every 3 women die from heart disease every year. Cardiovascular disease is caused by the buildup of plaque in the arteries that supply your heart with the essential oxygens and nutrients that is needed. This plaque buildup causes a blockage that no longer allows for the adequate blood flow to and from the heart. You can control the health of your heart. With proper diet and exercise habits, you can reduce your risk of cardiovascular disease and potentially save your life. Oftentimes, people know that diet and exercise changes can reduce the risk of cardiovascular disease, but they simply don't know which ones to do. They don't know the best diet practices, and they don't know the exercise regimens or recommendations that are suggested for each person to do to protect the health of your heart. So let's take a moment to discuss a few of these exercise recommendations. The American Heart Association recommends that you exercise at least 30 minutes, 5 days a week, for a total of 150 minutes of aerobic exercise and a total of 75 minutes a week of anaerobic exercise. So you may ask, what is the difference between aerobic versus anaerobic exercises? Most people have heard of aerobic exercises, but they may not simply understand exactly what falls into those categories. So let's take a moment to discuss those. Anaerobic exercise simply means without air, meaning that you go without air. You seem short of breath very quickly because these are high intensity exercises. These are high intensity exercises like weightlifting or sprinting, running quickly. And what you are doing here is you are quickly strengthening that muscle, which is making you short of breath. The heart is a muscle, so weightlifting and getting your cardiac rate up quicker causes the heart to be strengthened. So this is why it's required for us a less amount of time during the week, such as 75 minutes weekly of anaerobic exercise. Now, for aerobic exercises, this is the one that is recommended by the American Heart Association for 150 minutes weekly. This is with air. You don't get a shorter breath as quickly with aerobic exercises. These are low intensity exercises that you are able to gradually work and burn off the fat, as well as strengthen the heart at a slower progression because you're not burning and getting so tired so quickly. You're not getting short of breath as quickly. These exercises consist of walking, bicycling, and things of that nature. Things to get your heart up and running at a higher rate, but not wearing you out as fast as sprinting or lifting weights. Those are a common exercise that you can do for the anaerobic versus aerobic exercises. Now for a few diet tips to help you with your heart health. It is best to eliminate cooking with grease or frying foods. Grilled is the best option when you're considering how to cook and manage the meats that you're eating. Protein is a good thing for your heart health, but you need to do more lean meats, things such as fish, poultry like turkey and chicken. All of those are good for your heart health. Grilling those is the best option again. Next, fruits and vegetables are high in fiber. This is great for the heart as well. This helps to lower your bad cholesterol, which you often hear as the LDL. I tell my patients often to think of the LDL as L as in lousy and bad, and L for LDL. So increasing your fruit and vegetables, those are high in fiber, can lower those bad cholesterol. Next, you want to limit and eat in moderation your sweets. Although those cakes and pies, ice creams, and things of those nature are good, use it as a treat, maybe once a week or less if possible. But eliminate those because carbohydrates are not great for your heart. It can also cause diabetes, which is one of the common risk factors for heart disease. Lastly, you want to consume a diet low in sodium. So things that are processed, that are in cans, packaged, and things of that nature are high in sodiums. Be sure to read the labels. Don't add any additional salt to things, as well as this can increase your risk for heart disease, hypertension, and things of that nature. A few things to go over real briefly. Again, proteins are good for you, such as the fish, your beans, your poultry like turkey and chicken. And again, they are best grilled. Fruits and vegetables are great as they are a good source of fiber and they decrease your bad cholesterol. Consuming about 5 servings of those daily is the recommendations. Um, Dairy intake is good, and whole grains and brown rice and nuts are also great for heart health. So I just wanted to take a moment to provide you with a few little helpful tips of diet and exercise, as well as a little bit of background on heart disease, to hopefully encourage you to make lifestyle changes to prevent you from having cardiovascular risk factors and potentially save your life.